Stress and anxiety is like a loudspeaker.
Okay.
It tells you that something is not right. It can make symptoms or amplify symptoms. Now, stress and anxiety by itself don't cause ulcers
Okay.
directly. Uh, Sometimes it may um, um, stimulate or worsen acid
Oh.
production. It may have an effect in the motility of the stomach. It may reduce emptying. But it also has a very important effect on the brain.
Assalamualaikum and good day to all of you. We are back again at KoPiJom podcast by KPJ Healthcare. We are now with our own upper GI surgeon, Dr. Vijaya Shankar Arunachalam at KPJ Seremban Specialist Hospital. Welcome, Dr. Vijay.
Hi, morning, Nana.
Good morning, Dr. Vijay. Thank you for joining our KoPiJom podcast today.
Thank you for inviting me.
So, what first made you interested in diseases of the stomach and esophagus?
Well, I when during my surgical training, I got interested because of the intricate anatomy of the stomach and esophagus, and I also found that the stomach and the esophagus and the stomach are like gatekeepers of the GI tract. If someone had a problem with the gatekeeper, there are a lot of health issues. Some of them are like very bad reflux, ulcers, and even cancers. Helping these patients relieve their symptoms and give them a good quality of life, in fact, and also cure them of cancer, was very rewarding. And that's the reason why I took up upper GI surgery.
Happy gut, happy lives.
Happy gut, happy life.
Alright. Now, Dr. Vijay, many Malaysians say, I just have gastric. When does gastric pain become something more serious like GERD or ulcers?
That's a very, very, very good question, because gastric is a term which is commonly used by so many patients without actually knowing what it actually means. Now, it's an umbrella term to mean pain relating or resulting from a stomach condition. And some patients even loosely use it for reflux. To be very certain what the patient has, reflux or gastroesophageal reflux disease is basically reflux of stomach contents, which is commonly acid, into the esophagus. And that causes a very classical or typical symptoms like burning sensation or heartburn. Whereas gastric pain per se due to inflammation of the stomach like gastritis or ulcers present differently. Commonly, if your patient would have an ulcer in the stomach, they may have a dull aching pain in the stomach or the epigastric region, and this may get better after a meal, but only transiently. So if you have pain in the stomach area and it doesn't get better, you may need to be assessed because you may not be actually having gastric or gastritis. It may be something else.
Yep. Alright, so it may not just a gastric.
Exactly. It may
Alright.
not just be gastric. Yeah.
Alright, Dr. Vijay. So, now what are the red flag symptoms that people should not ignore, doctor?
Okay. I think it's very important when a patient recognizes that the symptoms are persistent despite medications. The symptoms are recurrent. That means you ambil ubat pun you tak baik. It
Yep.
just keeps coming back. If there's a change in the color of your stools, if you have black stools, or we call it in medical term black tarry stools, we always tell the patients, pakcik or makcik, kalau ada najis macam hitam. That's very important because it tells you that there is an ulcer in the stomach, and that ulcer is bleeding. So if you have a bleeding ulcer and if it's a slow bleed, that blood mixes with the acid in the stomach and changes your stool from brown to black. And so that's a very important alarm symptom. And because many patients take medications like aspirin for their heart, and aspirin can cause ulcers, though it's good for the heart, but if you don't warn them of the side effect, they may realize that passing black stools is just something normal. So persistent symptoms, symptoms not getting better with medication, passing black color stools, weight loss, unintentional weight loss, or new symptoms occurring at the age of 40 or 50 in the middle age or elderly. These are symptoms which should not be taken lightly, and you should be seeking a doctor's opinion.
Yep. So there's another red flag symptoms that maybe many people can relate, which is some people feel burning chest pain after eating and think it's heart related. So how do you tell the difference between a heartburn and a heart attack?
Oh, Nana, that is such an important question, because when you have a heartburn, it is basically acid going into the esophagus, and the symptoms are just burning sensation. Okay, some patients may just belch up food that they've eaten, but chest pain because of a heart attack is very different. It is often described as a very painful a pressing or a stabbing pain, and this pain may not just be in the chest, it may actually spread to your shoulder, to your arm, and even to your jaw. You may actually have palpitations, or you can feel the beats of your heart. You may have perspiration or sweating, and you may also have difficulty in breathing. So if you have any of these symptoms, then you really need to go and see a doctor and not just think that it is gastric. Although the esophagus is in close proximity with the heart because it's in the chest, if you dismiss symptoms such as heart attack, it can be fatal. So it's important to know what the symptoms of heart attack is and seek treatment if you have one.
All right, Doctor. So you yourself, Dr. Vijay, your experience, have you ever seen a patient who thought that it was gastric, but it turned out to be a heart problem?
Yeah, I have. In fact, coming back to that question earlier, if you have any doubt, okay, it's important to treat the heart, because the heart, the gut or the reflux won't kill you, but heart attack would. So coming to, have I ever seen a patient? Yes, I have. It so happened there was a patient in KPJ Seremban and was admitted for an orthopedic condition, and just before got discharged, the patient complained of having pain, and I was referred to. A patient was referred to me, and when I checked and examined the patient, I realized, hey, this is not a reflux pain. This is something more serious. And true enough, the ECG showed that the patient was having a heart attack, and I referred the patient to my cardiologist colleague, and he was so lucky. The patient was so lucky. He had his heart attack in the hospital, and he had timely intervention, and he was saved.
Yeah. Oh, so he had a heart attack.
He had a heart attack.
In the
It so happened he had a heart attack in the hospital. Whoa. And it presented as so-called reflux or gastric-like pain, but it turned out to be a heart attack.
Thank God for that.
Yes, thank God for that. Absolutely.
Okay, now, so people often take medication from pharmacies for years, doctor.
Yeah.
So when should someone actually see a specialist rather than just taking pain medications more and more? When is the borderline to see a specialist?
Well, as I mentioned earlier, GERD is something very, very common, right? And often it is commonly labeled as gastric. Now, if you have if you're taking medications from the pharmacy or from your general practitioner, and if you're not getting better, or if the symptoms are getting worse, or only transiently relieved, then you should see your doctor. I think you should avoid skipping and going from one clinic to another clinic, you should just stick to one clinic and so that the doctor is able to see that, oh, you're not improving,
Yeah.
and you should, and if you're not improving with the medications, and that would warrant a referral. Right?
Yeah.
So if the symptoms persist, if the symptoms are getting worse, you should see your doctor.
Yeah, and then the doctor have your past
And the doctor has a past
history,
medical history and will be able to
easily to
to
refer.
identify that, oh, whatever treatment that I'm giving is not getting better, then he should get evaluated.
Alright. Okay, now we're gonna go to another interesting topic, which is very close to our very own Malaysian people, Dr. Vijay.
All right.
Which is lifestyle and daily habits. So, now, our diet, doctor, as a Malaysian, we include spicy food, late night meals, and coffee. How much do this contribute to reflux or GERD?
A lot. In fact, our favorite pastime is eating. And in Malaysia has 24/7 eatery in the form of many mamak shops and late night dining.
Yeah.
So what happens is, if you have a heavy meal at night, okay, and you sleep very early, too soon, whatever food that you ingest is going to overcome the barrier between the esophagus and the stomach, known as the esophagogastric valve. So a heavy meal at night triggers acid production, and when you sleep early, the food that is going to remain in the stomach is going to overcome this barrier. So acid is going to find its way into the esophagus, and it's going to trigger an acid reflux.
Now, if Malaysians could change one habit to protect their stomach and digestive health, what will it be, doctor?
My recommendation would be to have a small dinner and a small dinner, and not to sleep or space out your dinner and your sleeping at least 3 to 4 hours. Also, watch your portion at night. So by changing your lifestyle, by eating less oily or less fatty meal, keeping your portions and keeping a distance between the time you eat and your sleeping habit, really is able to do 3 things. One, it's you will have less night reflux and you'll be able to sleep better. Number 2, you also have the benefit of managing your weight, because you should have a light meal rather than a heavy meal at night, and that can definitely change. That change in lifestyle can really help you in the long run.
Yeah, then we can be healthy then.
Yes, definitely.
So, is it true that stress alone can cause gastric problems, or is there usually something else happening in the body?
Well, stress and anxiety is like a loudspeaker.
Okay.
It tells you that something is not right. It can make symptoms or amplify symptoms. Now, stress and anxiety by itself don't cause ulcers directly. Sometimes it may stimulate or worsen acid production. It may have an effect in the motility of the stomach. It may reduce emptying, but it also has a very important effect on the brain. It's interesting to see that people who are anxious or who are having stress perceive pain more easily, and small twinges also get magnified. So while ulcers are basically, for example, stomach ulcers are basically due to a combination of factors like H. pylori infection or medication like taking Ponstan or Voltaren, or even smoking, pain is actually magnified because of stress anxiety. So it doesn't directly cause it, but definitely the perception is magnified.
People say drinking milk, doctor, helps gastric pain relief. So is that a myth or a fact?
That's a good question. Milk is white, and a lot of patients have taken MMT or antacids, which is white in color. So they think that the antacids have given reliefs. It is white in color, so milk should do the same because it's white. And sometimes they take a cold milk, which just gives some temporary relief because it has a soothing effect. But milk has got protein, casein, which is protein, milk protein, and milk has also got fat. And the combination of protein and fat stimulates acid production in the stomach. So after some time, you may find that your symptoms may get worse because now that you have acid being produced, this acid may find its way in the esophagus if your valve is weak.
Yep.
And although you may have some temporary relief, in the long run, you actually may make your reflux worse.
Oh, all right. So we need to be careful.
You got to be careful, that's right.
Yeah.
And in fact, some patients have lactose intolerance and they get even more symptoms.
That can make more worse.
If you have a good competent valve, then you can take a normal amount of meal. But as I mentioned to you earlier, you should always have your dinner the smallest. You should have the breakfast. You eat like a king, right? They eat your breakfast like a king, okay? You have a big meal in your breakfast and eat a smaller meal in your lunch, and the smallest in dinner, because we want to have time for your stomach to digest food, okay? And you don't want to eat a big meal at night, which is unfortunately very common in Malaysia because of working shift system, or because you don't have time to have a big breakfast and you only can have a big meal at night. So they eat at night and soon after that sleep. Now, if you have a weak valve and you know that your valve can be overwhelmed by a meal, it makes sense to eat small portions more frequently so that your valve doesn't get overcome and your reflux symptoms can be controlled. So yes, it is important to know that if you do have reflux and if you've been investigated and you know that your valve is weak, it is a good practice to have small spaced out meals, because with small spaced out meals you don't overburden your valve, and you can get a good relief just by lifestyle modifications.
I see. Alright. So now we're going to go to our last topic, which is surgery and modern treatment, which is your specialty, doctor.
Yeah, okay.
Alright. So when does GERD become serious enough that surgery is usually the better option?
Okay, if you have a condition called a hiatus hernia, then have a large hiatus hernia, this is causing acid reflux and volume reflux. Volume means the food that you eat just comes up after some time, even you belch. Then it is important, or it's advisable to tighten the valve. If you have acid reflux and you have a weak valve, you get some relief with your medication, but it's only transient. Or if you don't want to take medication for lifelong, and you're young and you're healthy, in addition to a weak valve that causes your symptoms, doing surgery to tighten this valve can go a long way in ameliorating or reducing your symptoms. So in short, if you're symptomatic reflux, if you have been scoped and you have a hiatus hernia, if medications don't give you complete relief or only just partial relief, if you don't want to take medications for long, then surgery would be an alternative to medication. Bear in mind that not all patients with reflux need surgery, but if you fall into any of this category, then surgery can provide long-lasting relief.
Now, talking about surgery, doctor, so we have minimally invasive surgery here in KPJ, right? So it's now common now. So how has this changed recovery for patients, and especially for patients with reflux or hiatus hernia, the recovery?
Minimally invasive or keyhole surgery has changed the landscape of surgery. Traditionally, there were long cuts, and long cuts mean pain after surgery and delayed recovery. Now with minimally invasive surgery or keyhole surgery, the incisions are all very small. It's about a centimeter or less. So you can have the surgery with about 4 or 5 incisions, and the patient has a very good recovery because the pain control is very good, and the patient can go back home in a day or two, and the patient can soon resume work in about a week. So minimally invasive or keyhole surgery is a game changer.
Do you have any, significant cases, or maybe what is the most surprising case of gastric that turned out to be something much more serious, just like when you mentioned just now, that instead of a gastric, the patient actually has a heart attack?
Okay, I can recall 2 other incidences. They're both of extreme ages. One is a young child, about 12 or 13 years old, who kept on vomiting, had pain in the epigastric or the center, and couldn't swallow. So she had gone to many clinic, and they labelled her as having gastric, but because she just kept on throwing and she couldn't eat, she had missed schools, and the mother was a bit worried and thought that she may be just mengada-ngada, didn't want to go to school. So when she came to me, the history was very classic. It's not gastric that was causing her the symptoms. It was a valve which was too tight. We call it achalasia cardia. And that valve, because it's tight, doesn't allow food to pass from the esophagus into the stomach, and therefore the patient just vomited after a few hours of eating. The patient was correctly diagnosed later on by endoscopy and manometry, and was successfully had surgery. But the patient presented with so-called gastric pain, but it was not gastric. And another condition was when an elderly patient, about 70s, she had a bit of reflux, and she was scoped by another colleague of mine. And during the scope, they identified an ulcer which turned out to be early gastric cancer. And the patient was referred to me, and she had surgery. And thankfully, because the cancer was early, she has been cured. So I think the take-home message is, I think, if you have symptoms which are not getting better, for example, the young girl, or you have symptoms in the elderly, you need to be investigated, and should not be just be treated as gastric.
So, you know what people saying, trust your guts.
Absolutely right, Nana. I think you should trust your gut. If something is not right, trust your gut.
Just go to any nearby hospital.
Get a second opinion, or get to see a doctor for further evaluation.
Even though it's just from a small symptom.
Exactly. Don't take your symptoms which are persistent, recurring, and don't get better lightly.
Thank you so much, Dr. Vijay. We are at the end of our show. Thank you so much, Dr. Vijaya, for the valuable and very strong insightfuls that all of us can take and learn. Something about our guts, our gastric, our GERDs, and all of that. I see you next time in KoPiJom podcast. Bye.
Thank you, Nana, for having me.
Thank you, Dr. Vijay, for coming. Bye-bye.